Ladies and gentlemen, welcome to the Artzrepublic studios. Today, I have two special guests, Ms. Anisha Gates, mental health coach, and on the extreme right hand side, I have Mr. Mike, aka Odumeje. Right today, we have very sensitive topics to hit and run on top of those topics. Ms. Anisha Gates, can you please introduce yourself to my beautiful audience?
Hi, everyone. I'm Arnisha. I'm the founder of Cope and Place Foundation, Inc., which is a nonprofit for mental health awareness and mental health. Once again, I'm a mental health coach. I teach anger management. I have a mental health resource center where we have people come in and they discuss mental health issues. We have a round table that's called Bring It to the Table, where you can come in and it's about between 4 to 5 people come in and we sit down and we just discuss mental health. We discuss the issues that they have going on and we try to bring some type of solution to their problems. We also have like the outreach center where we resource we have resources for our patients to come in and get resources like if they need medications or if they need transportation to get back and forth to the clinic to get their medications or to go to therapy, other therapy sessions. We also do this thing called like it's like a paint project that we have where you can come in and you can sit down and you could just paint what you got going on. Like you sit there and we have this day where you come in and you just sit and paint, or you can come in and you can watch TV if you around and you just need an outlet, so a place to go and just just relax your mind. It's a judgment free environment for you to come and just be you.
That's coping place for you, my people. And coping place is there to do the maximum therapy and making sure that once you visit coping place, you will never leave the same. And on the right hand side, extreme right hand side, we have Mr. Mike, aka Odumeje. He has his own ideas, trying to take mental health evaluation and therapy down to the African continent. Mr. Odumeje, aka Mr. Mike, tell us more about that.
Thank you very much, Dr. Lee. Anisha, you are welcome. To my own side, what Miss Anisha got going on, I embrace it already, and I wanted to take it to the next level, take it to Africa, um, which we already have a conversation before the same, you know. But at the same time, you know, in Africa, most of people in Africa don't believe they have a mental issue. But I don't blame them because average Africa, average, let me just use the word average, believe that people that has mental issue are mostly the one walking in the street
Naked.
naked or some homeless people, you know. But it's not like that. It's more to that. And the service that you render is a good thing. But I have a few questions that I would like to ask. Like the therapy.
Before you get to the question, Mr. Mike,
Mhm.
I want us to talk about the causes of mental health situation before we get to those questions you have to ask.
Okay.
However, we have people who are suffering from, bipolar. They are suffering from PTSD. They have different kind of stress levels and depressions. So, to the best of your own knowledge and understanding as a mental health coach, what do you think are the root causes of these mental health issues that we have in our societies?
Well, mental health issues can come from a variety of sources. It could come from being traumatized. It can come from schizophrenia. They say that schizophrenia it just comes out of nowhere.
Hmm.
The doctor said from between the ages of 13 to 30, you can just automatically just get schizophrenia out of nowhere. Like, and Schizophrenia is where you start to hear voices, and just out of nowhere, you just hearing these voices, and you need medication to stabilize the voices so you can, that the voices are not going anywhere. When you see folks walking around here talking to themselves, they're not talking to themselves, they're talking to the voices that they're hearing in their head. What the medication does, it helps them to not hear the voices as loud. So with that situation, you have to have medication. There's no way. Like, if you look up schizophrenia, there's no cure for schizophrenia.
Let's get it clear. Schizophrenia, is it the only mental health situation that warrants medication, to the best of your coaching experience?
No, it's not. Like depression, for depression, I'm not going to say you need, because some people don't need medication. Some people can do self-therapy. Like I teach the painting. Some people come in and you can just paint, and you love, extra love, somebody loving on you, or being around your family, or doing extracurricular activities, or taking your mind somewhere else, or doing things that you enjoy. You can do that, for therapy, or being around family members, cooking or something like that, doing something that you really enjoy to take you out of that state of depression that you're in.
But for how long? For how long does that last?
When you're depressed, there's no such thing as, I'm going to be depressed for 30 minutes, or I'm going to be depressed for an hour, or 2 days, or 3 days. You can be depressed and then...
What other mental health cases warrants medication apart from just, self-therapy and other remedies?
So if you're having a mental health crisis, if you're in a crisis and you're like, okay, something happened to me, hypothetically speaking, if I was to get raped, or if I was to be in a relationship with someone and I got beat up or whatever, and I didn't got depressed, and I'm going through a crisis, and I feel like, I want to kill myself. My life is just over, because expectations. People thought that, I'm this perfect girl, and I will never get raped, or I will never get beat up, or whatever. So now I'm feeling like, oh my God, they're gonna judge me. I don't want to live. I don't want, So you would go through a situation where some folks might want to say, I don't want to live anymore. Like, this is not me. I'm too good. This is not the life that I want to live. This is not where I'm supposed to be. I'm ashamed. I don't want, I don't want nobody to see this. I don't want nobody to know. I'd rather be dead. So you have folks that think like that, and they commit suicide, or they think about committing suicide.
When you talk, before I get to Mr. Mike, when you talk about, this is what people think, this is what people don't think, a lot of societal issues are being, done because of what people expect or think of how the society would think of them. For example, people don't really care about what goes on with you, but yet a lot of people still think that, if I do this or I don't do this, people will say this or they will not say this. I believe in the situation in which people have to start seeing the facts of things rather than their feelings over things. Exactly. Transiency is the science that depicts or illustrates the fact that nothing ever lasts, not your feelings, right, but the truth will always remain.
Exactly.
So I will go straight now to Mr. Mike. I understand that people say that taking medication is a good remedy for mental health issues. Of course, you said that those are temporary remedies.
I don't think medication fix that situation, because if something is temporary, it's not fixed. So to my understanding and the people testimony and what I've seen, I think it's better to find the roots of the problem. Root of the problem, number one. And if one with the victim can talk about it, I think it's going to get better.
So you are advocating for one-on-one therapy sessions in which people talk to people in order to understand what they are going through.
What they are going through, yeah. Talk one-on-one what they are going through, And if someone will admit, if someone in that kind of situation can admit and say the fact what is going through, and how long he has been with that kind of situation, I think it should be fixed. Sometimes medical was the situation, and
Are you talking
I mean,
about drugs,
about the drug, medical, yeah,
medications? Yeah.
medication. I mean, it was the situation sometimes because it's temporarily. In my weaker system, you sleep. When you wake up, it's gonna be the
Or
same
you might
thing.
be addicted to
Or
those
maybe
medications.
addicted to it. Thank you.
Like
Thank
opioids.
you.
We're talking
Exactly.
about opioids
Yeah,
right
you
now.
might be addicted to it.
So, right now, Ms. Anisha Gates, what do you think of what he said with regards to all of his points?
Well, referring back to what Mike said pertaining to the people in Africa, they're running around with their clothes off and all of that. That's not normal. That's not normal behavior. So evidently
Point
that's
out, excuse
something.
me, I'm not trying to cut you off. I didn't say running around with nakedness.
Well,
What I said is this. I said, but what I'm trying to make you to understand about Africa, mostly people in Africa, they believe that people that has mental issue is those one on the streets.
streets. Okay.
Also, it came to my attention once upon a time that in Africa, most people who suffer from mental health issues of different sorts, which they cannot even diagnose or understand, they attribute that to witchcraft. They might say that those people are bewitched,
Bewitched. But it's not.
but it's not.
No, it's not witchcraft. That's why I said most people they see those one as people that has mental issue. But there are some people that are traumatized. Maybe rape, maybe from the war,
PTSD?
maybe, they don't meet their expectation. So in that kind of situation, how do we solve that problem?
Everyone should be evaluated. And with the evaluation, after going through the evaluation, it should tell you, okay, can you sleep? Are you sleeping? Are you staying up all night? Are you hearing thoughts? Are you, sad all the time? Are you having mood swings? The questions that they ask are going to let you know if they have some type of mental health issue going on. So I agree with you. Everybody don't need medication. Some people need some outlet where they can go and talk to someone and talk to them about their problems. And, and hey, maybe if you got this going on, I can tell you maybe you need to do this something different. Maybe you need to get up a little bit earlier, or maybe you need to have more activities in your day. If you sleeping all day or you sad, maybe you need to try something a little bit different. Maybe you need to try something that's going to make you happy.
So, Miss Anisha, I want to bring this forward. It is said that the number one cause of death in the retirees community, I'm talking about people who are about 55 to about 60, 70 years old, is depression. And this depression comes from not knowing where to get money to sustain the life that they have without even working. Because think about it, a normal human being has about 30 years to work, to live for about 40 or 50 years more, or even 60. So a lot of people with these retirement schemes that do not even fall through, they have too much expectation at the end of the day that cannot be met. For example, somebody works for the government for 30 years. He retires. And the life he's living, he has a little house that he has. He has some dreams, big dreams to cater for. But there's no money to cater for those dreams. So he wants to start over to become an entrepreneur at the age of 55, 60, 70, when he doesn't have the power to do that. So depression sets in. A lot of young people do not even have that opportunity to work for the government at this time. They don't even have the opportunity to have a job that can really sustain their dreams. They don't even have that knowledge to build businesses. That's why we came together, so that we can empower those people to be able to achieve and accomplish and fulfill the dreams that they have been longing to accomplish and fulfill in their lives. So tell us, what are those programs that you and SWAS are putting in place so that we can be able to, as a collective, impact those people to become, self-employed, to become bosses, to become educated. And that sense of accomplishment would really bring healing.
It's like a entrepreneur type of thing where we're going to teach them how to do different things, filming, and we're going to need makeup artists, we're going to need folks to come in and act, so we can help them to build and to become self-sufficient, and give them a reason to want to live, a reason to, oh, it's okay, we can do this at this age, at the age of 55 or 50. We can still continue to move on and live our lives.
That's right.
We just have to do it in a different aspect, from a different view. Maybe I wanted to be a plumber, but I can't be a plumber. But guess what? I can be an engineer.
That's right.
I can be a music engineer. I can be a cameraman.
That's right.
So we're going to implement these programs, and we're going to give them something so they can oh, wow, I can try this. I can learn this. So this is what we're going to do. We're going to bring this to them. Like I do at the coping place, I bring it to the table. We're going to bring this to them.
And there are a lot of people out there that are closer to your family. They could be your friend, your husband, your mother, your sister. Mental health crises and issues are real. A lot of people have bipolar cases, but they cannot be diagnosed because we tend to ignore the signs and symptoms. And right now, I want to pass it again to Miss Anisha Gate, the mental health coach, to give you her last words of advice on how to deal with this thing.
I would just like to say, talk. That's it. Talk. Speak up. Let folks know that how you're feeling, what you got going on. It's okay not to be okay sometimes. Everybody go through things. Everybody. But the best thing in life is to be open and communicate. Like, talk. It's nothing wrong with telling someone how you feel. And if you can't tell someone, write it on a piece of paper. Write it on a piece of paper and just bury it. Bury it so can't nobody see it, but it's there. Just get it out some way. But I really believe that you need to reach out. The best thing is communication, talking to someone. Even if you got a dog, so have a talk with your dog. Discuss it with someone. Communication, please.
What is it that people out there need to expect and they need to do in case they find themselves in very confusing situations?
Killing yourself, associate yourself from people will not help you. You need to speak. There's help out there. It doesn't matter what you did in the past. It doesn't matter where you are now. It doesn't matter whatever you have committed in the past. There's still life. And once there's life, there's hope. We're out here to help. Please, just speak. It's very, very important.
Thank you. Ladies and gentlemen, thank you. This is Blank Scripture, the podcast. Mental health issues, again, are real. Until next time, subscribe, and we'll see you there.
Thank you.
Thank you.